Hello again, everyone. Welcome to another episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels. And joining me on the podcast today is Dr. Susan Fox. She is a doctor of acupuncture and Chinese medicine and an expert in fertility. So today we're going to do a deep dive into fertility and infertility. So Susan, welcome to the show.
Oh, thank you so much for having me. I'm delighted to be here. And I love obviously talking this topic.
Well, it's interesting. I mean, this is your world, right? We're seeing this, I'll even say an epidemic rise of infertility, not just in the United States, but really around the world. I have my ideas on it, but what do you think is going on? Why are we seeing this like massive uptick of infertility in both males and females?
Absolutely, yes. And so I would challenge the word infertility out of the gate, because I think what we have is an epidemic of subfertility. And the reason, I believe, is caused by our modern day lifestyle, our exposure to the toxic load of environmental toxins, food pollutants and additives, phthalates, all of these things that are endocrine disruptors, and then have, eventually, of course, an adverse effect on our hormonal symphony, if you will, in communication, such that it's creating these disease conditions or diagnoses. But those diagnoses are simply naming what has been a pattern for a period of time due to this insult to our bodies.
Yeah, I would agree. I think, when you look at what's in the food supply, what's in the air, we're kind of getting assaulted from all different fronts. It's what we put in our mouth, what we breathe, what comes through our skin.
Mhm.
We're seeing a lot of young men with really low testosterone levels. We've
Mhm.
seen male sperm count drop drastically over the last 3 or 4
Precipitously.
decades.
Mhm.
And I think what's really frightening too is, some of the research even suggests that this is generational. This isn't even like what you're exposed to now. It's our parents and our grandparents' generation that's also influencing that. And of course, our world has gotten more toxic as the years have gone on. So you've got, I guess, a lot of uh, challenges in your work to try and help override what's going on out there in the world. Can you just talk a little bit about sort of the general background about acupuncture and Chinese medicine for those who may not be familiar with it? I think at this point, a lot of people certainly have heard about it, but they may not really understand it's an entire system of medicine that's completely unlike Western medicine.
It is. It's a whole systems medicine that includes observation and pattern diagnosis. We don't just take a look at the symptom and name it a diagnosis and then band-aid that. We look at the entire person's lifestyle in a deep history. We liken our own beings to that of nature, because we observe the same patterns in nature. So we speak to the five elements and the five organ systems and like that. And then we say, what's gone out of balance? Are you showing up as being too cold or too hot? Are things getting sort of stuck and not flowing? Is your blood too thick and coagulating, or is it, gushing too much when a woman is having a menstrual bleed? And we use those patterns to say, okay, this is where things went sideways. Let's correct the patterns so that we can, in many cases, reverse the diagnosis, and oftentimes really either help with improving a successful IVF or advanced reproductive therapy modality, or oftentimes a person can enjoy natural conception, because the body is brilliant at being able to take in the input we're giving it. If we start giving it correct and healthful input, it will make those adjustments. And as you say, not just for this person's ability to conceive, but to have a healthy baby, and to help future generations as well.
I think what I really appreciate about acupuncture, Chinese medicine as a whole, it really is. Well, first of all, I think it's just fascinating the fact, this is 5,000 plus years old,
It
like
is.
Ayurvedic medicine,
Mhm.
that at a time where we didn't cut into bodies, everything was really based on observation.
Mhm.
So again, you could have 10 people that get migraine headaches, but the traditional Chinese medicine diagnosis and treatment could be completely different because it really is tailored to the individual, isn't it?
Absolutely. And again, it's tailored to how did those migraines come to present. If it's a menstruating woman, is it presenting at the time of her, post ovulatory period, which would tell us ovulatory time frame, which would tell us that she's having some liver clearance issues. We refer to that as liver qi stagnation. If it's coming at the end of her menstrual bleed, then we would say she probably has a blood deficiency. So obviously we're going to treat an excess and a deficiency entirely differently, which is very different than the conventional medicine model, which would say, here, take this prescription and mask the symptoms.
And then you're looking at people's tongue, you're actually taking their
Mhm.
pulses. So, in
Mhm.
Western medicine, we take your pulse, how fast is your heart beating?
Right,
But
right.
if I recall, again, I have a very rudimentary understanding of Chinese medicine, but there's like 3 different spots on
Mhm,
the pulse that you're measuring the depth, the quality of the pulse, and it gives you a
mhm,
lot of information about what's going
mhm.
on in the body.
That's exactly right. Yes, and there are 3 on each side, on each wrist, and in those 3 point locations, there are actually 6 pulses. So we're getting 12 pulses in any time we're testing someone. Oftentimes I would find myself, I will use the pulses kind of as confirmation that my intake is correct, because if I'm really listening well, that person's going to tell me what's going on. And I think that's part of the dilemma of conventional medicine is there's no time to listen well to what's going on. So they need to, use labs or whatever. And I'm not opposed to labs. I think they're brilliant and great data points. But if we were to listen, we could use tongue and pulse as either confirmation or contradiction. If we think we're, on the right path, but the pulse or the tongue tells us something different, it will kind of help us course correct.
Well, I know in acupuncture too, there's sort of different styles. So there's traditional Chinese medicine, there's Japanese acupuncture, there's Korean hand acupuncture,
Mhm.
and there's something called 5 element, which I know is a big part of your practice. Can you just talk a little bit about what that means?
Yes, well, how I speak to 5 elements really has less to do with how I needle, and it has more to do with how I take in information. And again, particularly for the demographic that I treat, that I work with, the couple going through infertility challenge, it is not just what's happening in their physical body or their physiological body, it's what's happening in their emotional body. And that's where the 5 element model of Chinese medicine really is so brilliant, in that it has ascertained that for each of the 5 elements, there are different expressions of emotional stability or instability, depending upon how things are going. And so, how a person responds to her, I'm going to use the pronoun her, to her infertility dilemma, really does help guide me. So, for instance, if she is just angry as can be that she is in this predicament, once again, that's going to be more the liver organ system, the wood organ system, because the wood system loves to create and embellish and procreate. And when it is suppressed, all that creative life force becomes really quite irritable. It's under wraps, and it wants to express, so it becomes either depressed or too much expression with an anger and irritability. Whereas somebody who is perhaps a little bit more fearful about, gosh, will this ever happen? Will this ever happen? Will this ever happen? That is the person whose element is more in the water element, which governs what we call the kidney organ system, which in Chinese medicine is akin to our entire hormonal symphony, if you will. And so it's governing our reproductive hormones. So her emotional response, in my practice and in my work with clients as well, is really a key indicator, so that I'm not just relying on menstrual history and bleed length and any other kinds of signs and symptoms like cramping or things like that. I'm really getting an insight into who is this human being. And this is just my bias. I really think that because infertility is such an existential experience, it can therefore be an existential crisis. And to avoid that component of a person's health, I think really just sets her up for more failure, more disappointment.
I used to see a lot of fertility couples when I was in Connecticut years ago.
Mhm,
My practice has changed a little bit since then. I don't see nearly as many. Most of who I was working with was women,
mhm,
but male factor is as much of the issue as female factors, right?
absolutely.
How important is it that, men, the male partners are part of this process? Because we know that half of, fertility issues are due to sperm issues.
Yep. Yep, I think the statistic is about 40%, but that's close enough, right? When a
Yeah.
couple is having infertility challenge, we really do have to look at male factor. And in that case, a man is a little bit more revealing, if you will, with his semen analysis. We can kind of see the parameters and see, is male factor a component? I would love to work with every partner in a couple who's struggling with infertility, but that is really not how it comes to pass. Usually it is the woman, the person with ovaries, who comes in to see me. And so I will ask about, what is your partner's, nutrition and lifestyle like? Is he on on Zoom calls until midnight or 1 o'clock in the morning, or does he carry his cell phone in his pocket, or is he eating fast food? And I'll make those recommendations. But of course, as that person is not my patient, I can only be making recommendations for antioxidant and nutrition support. If he comes in, then I can do a full, workup and treatment. And I really wish that our culture allowed and encouraged both people to participate fully, because while he can be kind of relegated to, take this supplement and eat this well and get your cell phone out of your pocket and stay out of the hot tub, he is too having an existential crisis. He wants nothing more than to be, fully present and supportive and engaged in this journey. And oftentimes I find that, he's sort of kind of just, back in the corner, waiting to give his sample when the time comes.
I know in the conventional medical world, when couples are having fertility issues, usually they're off to see a reproductive endocrinologist. They
Mhm,
might consider doing in vitro fertilization,
mhm,
IVF. Sometimes they'll do something a little less, maybe invasive, something like IUI, or
mhm,
they'll just take a male sperm and they'll just insert into a woman's vaginal area to try and help assist the process.
mhm.
But what's it like for, couples when they're working with you? What's the expectation of, is it just acupuncture? Do herbs play a role in
Mhm.
what's needed? What's kind of an expectation of working with someone like
Sure,
you?
sure. Well, it kind of depends upon where they are when they come in the door. If I have time with them, and they're not already beginning or, on the calendar for an IVF cycle, which is oftentimes the case, regrettably. But if I have time with them, I can use Chinese herbs, which are, in my opinion, miraculous in helping to make adjustments. If I don't have that kind of time with them, I do need to be respectful of the reproductive endocrinologist's requirements to be able to have controls over their portion of their work. And I'll use supplements, because they will do a fine job. They just sometimes don't do as magnificent a job as the Chinese herbs can do. And then here again, depending upon how much time we have, I will either see her once a week, or if it's getting close to a stim cycle and a retrieval cycle, possibly twice a week. And then if she can, I will send her home with both an infrared device and a TENS unit that we call TEAS, transcutaneous electrical acupoint stimulation, where she can, in the comfort of her own home and without having to run to a series of appointments, do this, getting blood flow to ovaries and uterus 6 days a week from the end of her menstrual bleed through either retrieval or ovulation, if they're going to try to conceive naturally, or to the beginning of her next menstrual cycle if they're going to take a pass that month.
For couples that maybe haven't quite gotten to the point where they know that there's a fertility issue, wouldn't it be great if they just come to see you right off the bat just to make
Oh my
things a
goodness.
little easier?
Oh my goodness, yes. Females will, go get their pap smear soon after they begin menstruation. I would love to see, people who may want to have a child someday. And frankly, even if they don't want to have a child someday, we can find potential problems down the road that would affect their fertility, and that could affect their perimenopausal time frame and menopausal time frame, and make those adjustments so that they're not going through this struggle and this expense and this crisis of infertility.
Is there any issue if couples are working with a reproductive endocrinologist? It's not like they do one or the other. They can do
No,
both, right?
I work very closely with all of the REIs in my area, because they know that, well, what they know is that I can help their patients with stress relief, and they consider that to be enough because, you know, they have but a few minutes, 15 minutes for their consult, and this person can take the time with me to sometimes I'm translating what the doctor is, you know, is either saying or prescribing or the IVF calendar protocol, and that alone, you know, takes the temperature down a bit so that if she's understanding what's going on, she can engage more fully. So yes, I work very closely with the REIs in my area, and I'm very grateful to have been able to collaborate with them for going on 23 years now.
I'm curious your thoughts. It seems that I'd see a fair number, I'll say women in particular, that tend to have a lot of autoimmune issues that also correspond with fertility. Has that been your experience as well?
Yes, absolutely. And that is something when I will look at labs if somebody's coming in as a patient and be looking for antibodies to see is autoimmune present because that really helps to design the treatment protocol and the supplementation, you know, even more precisely. And yes, I mean, a woman is more inclined to have autoimmune conditions because of our hormonal fluctuation. It's a much more complex, you know, set of instructions that the body is going through, and I think that does set her up for perhaps leaky gut, or which then becomes the autoimmune syndrome. But yes, it is regrettably more and more and more common for unexplained infertility, and I'm putting the air quotes there, to be an underlying autoimmune, either a present diagnosis, or we can just presume that it's not present yet, but it's happening because you can just see it in the patterns and the symptoms that show up.
Are there any restrictions in your mind with regards to age? I can recall again, having worked with couples where we know that as certainly women get older, egg quality can suffer. Men, I guess I guess a little bit more forgiving. We have men who are you know in their 70s and 80s that are still
Mhm.
able to reproduce, but that's not so much the case for women. When couples start getting older, is there a time frame where you're like, maybe it's time to say this isn't going to happen?
Yeah.
Is it just based on hormone levels?
Well,
what's
I
your
mean,
advice as people are
yeah,
starting to get older?
that's a very, very, very good question because you know, if someone is coming in at age 48 and has never had a child and is wanting to get pregnant, I will say we'll do the best we can to improve your whole health and your reproductive health, whether you get pregnant or whether we're setting you up for a healthier perimenopause menopause timeframe. But of course, the data is there and it's real that, you know, while it doesn't necessarily fall off a cliff, it's a precipitous drop in the likelihood. And so I will often encourage that person to also speak with a reproductive endocrinologist, because I don't want to be the one who takes that very small window and says, let's work together for 3 to 6 months and then have you go see the REI,
Right.
because it would just, in my personal belief system, be, you know, an unethical decision. I want us to work together to see what we can do.
Yeah, well, I think things changed a lot over the last couple decades. I mean, certainly of my parents' generation, getting married and having a family in your early 20s was pretty normal. My
Mhm.
grandparents' generation was probably even in their teens. And
Mhm.
now I think we see a lot of couples, it's really their 30s and even 40s that,
Absolutely.
they're thinking about starting their family. So,
Mhm.
but yeah, this
And
like,
yeah, I understand that, and I support that, but all the more reason why I ask the universe and anybody who's listening who might have a place to help encourage these people to get a workup. You know, we get a baseline for our teeth, for goodness sake,
right.
or our heart, or as I say, pap smears or whatever, to just be able to get a baseline to understand that if everything's smooth sailing, fine, let's keep it that way. But if there is evidence that there may be a problem, it's so much easier to address it earlier on than to wait until that, you know, 38, 39, 40-year old comes in and says, now I'm ready and now I'm struggling. And oh, by the way, I always had menstrual irregularity.
Right. Right. I want to clear up a little bit of, I think, a misconception about Chinese herbs. I mean, I hear this all the time, and I'm sure you do too. Oh, it comes from China. Everything from China has got lead. It's toxic. Can you speak a little bit about the nature of Chinese herbs, the quality, how they're sourced?
Yes. Yes, I can. And in fact, I'm sort of on the fulcrum with the concern and the assertion that if you go to a good Chinese herbalist who is sourcing from a resourcer that is checking the palettes when they come into the dock and making sure that it looks like it's supposed to, it's not infested, then you're going to get a high quality herb. And I personally prefer a concoction that is, more of a distilled concoction where I can get a certain an understanding that what is in a dose is going to have the right dosage of each herb in the formula.
Right.
Tinctures is my preferred way because that way you can get about a 12 times concentrate. Whereas sometimes these little black rolled pills that we learned how to make in Chinese medicine school, you don't know if any one of those pills has any of the ingredients of the formula that you just bothered to compound with a mortar and pestle. And if a person is taking, a dozen at a time, they may or may not be getting the formula that you intended for them.
I have taken my share of little black BBs over the years. So
I think we all have. Depends upon when we started this journey.
well, my ex-wife was an acupuncturist, and I remember when she was
Mhm,
at school, they were using raw herbs. So I would
mhm,
come home to barks and berries and God knows
mhm.
what boiling on the stove, stinking up the whole
Absolutely.
house. I think I learned never ask what's in a formula. Just take it, accept it, trust your acupuncturist,
I think that's a
but
wise decision.
you probably don't want to know what's actually in there.
Exactly, exactly. It's good for you. I can promise there is no eye of newt. Well, we can leave it at that.
Well, if there's, three tips you could give to couples dealing with fertility issues, the things that they can do today, what would you recommend?
Okay, great. The first thing I would say is take action. Take calm action. It doesn't serve to just be, fearful and wondering and worrying. But then I would also say be in charge. Have agency with whatever healthcare provider you are going to see to support you in your fertility. I often say we work for you. In fact, we work for your ovaries and we work for your testes. So don't get that white coat syndrome of just sitting back and nodding and taking whatever is being directed at you. Engage, that you have the right to know what's going on with your body and in your body if you're taking stems. And then the third thing I would say is my mantra is engage 100% and surrender 100%. If there's any time in life where we square off with life, capital L, and whatever name you might ascribe, if you have a spiritual inclination, it is in the realm of fertility and pregnancy and birth. And then as we usher out the realm of death, we have to engage fully, and then we have to surrender fully. And in that surrendering, I believe that we create the space where nature, abhorring that vacuum, will fill in what we want to bring in. But when we're just trying to really push it the way we have been trained, if you do this, you get that. We're closing our chi, if you will, and we're closing down our systems at the energetic level, and it becomes its own foretelling, its I forget that phrase, its own destiny, if you will.
Well, I think this is where, again, Eastern and Western medicine blend so beautifully. And I've seen it in my own practice where, the help of the reproductive endocrinologist with the acupuncture, the Chinese herbs, the mind body medicine, all of this together can often lead to a very successful pregnancy, healthy baby. And so if you're listening and this is something you've been struggling with, I highly encourage you to take note of all this and don't feel like it's one or the other. You really can blend both quite well together. Well, I know everyone listening is going to want to come see you in person, but I know that's not always practical.
That's
But I
true.
know that you have an online course that you've developed for people who can't come see you in person. Can you tell us a little bit
I
about?
do. Yes. Thank you. Yeah. One of the silver linings of 2020, 2021 was that we had to be able to outreach to people who couldn't come in the door. And so I designed a course using the Chinese medicine 5 element model. And it includes mind body meditation with binaural beats. It includes Qigong exercises for the 5 phases of the 4 weeks of a menstrual cycle. It includes targeted circulation that I think is is the secret sauce, the special sauce to really help get a body ready for pregnancy or an improved IVF outcome. And it also includes a quiz that someone can take to say, which element am I? Because sometimes, we kind of like astrology. We want to know, what am I here? And it will really help. Your answers will help define which element is your sort of predominant element and how you might be able to realign yourself to become more in harmony so that you're healthier. And so there would be free reports and emails following up to kind of give some tips and tricks. And the quiz is yourfertilityquiz.com. And the course is entitled Your Fertile Health at healthuniversity.co. And university is spelled YOU. And I'll supply you with the links so that you can put them in the show notes if anybody's interested. I do offer an assessment call if somebody, is just still curious or has questions, to make sure that this is right for you.
Well, that's great. I said we'll include all the links in the show
Thank
notes,
you.
absolutely. And again, for people tuning in, I'd highly encourage you to check it out because again, knowledge is power. Having more information, and again, I think people think even with acupuncture that I've got to stick needles in, but you can use acupressure. You can stimulate these points in other ways, and I think that's part of what you're offering folks is something
Absolutely.
that you can do on your own at home. Hopefully you can get in touch. And I know there are other acupuncturists out there, certainly in the United States, that specialize in reproductive medicine. So there are folks out there. I think ABORM has a
Thank
list.
you. I was going to say that would be a plug for the Acupuncture and TCM Board of Reproductive Medicine, aborm.org. That way, you know that the person you are contacting has demonstrated a working knowledge of both conventional medicine and Chinese medicine, so that you're going to get the best education and support you need for your fertility journey.
Well, Susan, I'm grateful to have you with me today and share all this great information.
It's
And
been
I
my
hope people
delight.
again tuning in the course. But again, I just thank you so much for joining me today.
Oh, thank you for having me. I'm very grateful.